Hello from Rachel and from me, and thank you for joining us. ITV Border can reveal tonight that services for women wanting to have their babies in Galloway won't resume until at least the spring. There's been no provision for births at the Clennock Centre in Stranraer for months because of a lack of midwives.
That's left expectant mothers with a journey of an hour and a half to get to hospital in Dumfries. For some families, it's a cause of anxiety and anger. Charlotte Briere-Edney has been following the story in Stranraer. Charlotte.
Yes, the birthing centre here has effectively been closed since January, as keeping it open would mean the current midwives would be overworked and overstretched. Now, local MSPs are calling on the Scottish Government to do something about it. Unfortunately for people here, though, solutions are not forthcoming. 8-month-old baby Maya is happy and well, enjoying life in Stranraer. But her arrival into this world wasn't this relaxed. Mum Alea had to make the 1.5-hour trip to hospital to give birth.
The thought of going into labour is still scary. It's like, because every birth is completely different. And I don't think it's fair to have to travel that much of a distance without any doctors, midwives, pain relief, nothing. You've literally just got to sit there. And anything can happen. So if you start bleeding or anything, there's nothing you can do. You're literally just on your own. And I just think it's really unfair for mothers to have to go through that experience.
They're one of hundreds of families forced to make this journey for the birth, but also for pre-birth care.
I mean, from Alea's point of view, the scans were quite regular because the baby was growing too big. So it was scans every 2 weeks doing that. And it's got to be a stress-free time for a mum, and it wasn't.
It's because birthing services at the Clennock unit in Stranraer have been out of action for months due to a lack of midwives. The suspension was supposed to be temporary, but because of a combination of sick leave, maternity leave and staff resignations, and despite huge efforts to recruit, there's still not enough midwives to run an on-call service. And that's not likely to change until at least spring next year.
It's hard across the whole of Scotland, and especially remote rural areas. Midwives, when they're newly qualified, they want to consolidate everything and get lots of experience. They're not wanting to go to the smaller units where there's less activity. And really we would like experienced people to go to those areas because they're out there on their own working. And the whole of Scotland is just struggling with recruiting midwives currently.
NHS D&G stress there's no lack of funding for staff and full postnatal care is available locally. In Galloway, campaigners for better local healthcare services say this corner of Scotland has been forgotten.
Repeated governments have failed to actually invest enough money in the health service. They haven't trained enough doctors and nurses, and now we're reaping as we sow because we just don't have enough trained staff within Scotland, and it does seem to be worse in Dumfries and Galloway.
The Scottish Health Minister wasn't available for interview. In a statement, the government did say, "We are aware the Clennock Birthing Centre at the Galloway Community Hospital has temporarily closed. However, NHS Dumfries and Galloway have sought to reassure us they are committed to reinstating services and are actively recruiting staff." Locally, those in healthcare and patients understand that only more midwives can solve the problem. The worry for mums like Alea is that if recruitment fails, there's no plan B.
So, Charlotte, you say it'll be at least the spring before services resume. Why is that?
Well, in summary, because that's just how long it takes to recruit a midwife. Between advertising the position, doing interviews and allowing time for them to move, the spring is probably the soonest it would happen. And of course, that does assume that a suitable candidate applies to work here. And at the moment, there's very little health boards can do to make a member of staff work in a particular area.
So it's happening in Galloway now. There were similar issues in West Cumbria. Is this part of a wider picture?
I'm afraid it is. As you said, we've seen it in Cumbria. Viewers here will remember that 3 cottage hospitals have had to reduce the number of beds available in the last year. And it's not just midwives, it's doctors, it's GPs, it's other healthcare professionals. Of course, if there's a shortage of staff nationally, those staff can afford to be more picky about where they choose to work, and some remote locations will just seem less attractive. There are, of course, more staff being trained, but experts say that even then there'll still be a gap.
OK, Charlotte, thank you for the update.